Hi, my name is Caroline Henderson, and I'm going to be talking about hepatitis C, sort of a general overview for the condition our patient Mark has been diagnosed with. So to start off, what is hepatitis C? It's the most common bloodborne infection in the United States. It's a viral infection that leads to liver disease. It's also the leading cause of liver disease. There's no vaccine currently available. It belongs to the genus Hepatovirus and the Flaviviridae family. And it's a ribonucleic acid virus. And some of the physical characteristics of hepatitis C are that it's spherical, enveloped, and positive stranded. There's multiple genotypes of hepatitis C that have been identified so far. Genotype 1 makes up for around 60% of cases. It's the most common globally as well as in the US. Additionally, genotypes 2A, 3B, and 2C make up around 10% of US cases, and any other subsets of genotypes would be an even smaller percentage. It's important to know the genotype your patient has, as it can affect the severity of the disease and treatment options and treatment response. Another aspect to hepatitis C that makes it difficult to treat and difficult to have is the high mutation rate, and this is due to a lack of proofreading in RNA polymerase, the NS5B. If you're trying to make a vaccine or an antiviral medication, by the time you do all the work, your patient's strand has mutated several times over. So it's hard to play catch up with that. The global impact of hepatitis C. So it affects around 58 million people worldwide. We learned it's the most common bloodborne infection. The top countries with highest prevalence are Pakistan, followed by India and China. So the top three are in Asia. Transmission. So the most common mode of transition for hepatitis C is injection drug use. And this affects people who are currently involved, as well as people who are formerly involved in injection drug use. Some other risk factors are blood transfusions before June of 1992. The reason that date is so specific is because that's when screening standards were implemented for donated blood and organ transplants. So if you got a blood transfusion before that date, there's a higher risk because the donated material you received was not as heavily screened. Additionally, needle stick injuries, this would be relevant for healthcare workers, and something else to think about would be if someone's at home injecting a medication like insulin, if someone's diabetic, their insulin needles might be contaminated. They can have an accident related to them. Sharing personal hygiene items, and that could be like a razor or a toothbrush even. In rare cases, childbirth and sexual transmission has been recorded, but the main mode is going to be through infected blood and contaminated blood materials. Some environmental and social risk factors. So there's going to be a higher risk for hepatitis C contraction in underserved communities. This could be an area where the population is lower income, doesn't have reliable transportation, lack of access to education, maybe around health and safety precautions. And kind of on that same vein, poor access to medical care. If they don't have access to a primary care provider or healthcare education, they're not going to be able to be tested for hepatitis C, let alone treated for it. And additionally, they're not going to be able to hear about precautions to take. We talked a little bit about the global impact. That would be relevant to those geographic hotspots of infection. So your location in the world can also influence your risk. And all these factors we've talked about come together, and we learned that social determinants of health influence transmission. So all your social factors that make up your profile as a person can influence your risk of hepatitis C in subtle and indirect ways. So disease progression in early stage. So virus is detectable 1 to 4 weeks post-exposure. Viremia, which is viruses in the blood, peaks in 8 to 12 weeks. So the most amount of viral material in the bloodstream is going to occur in that 8 to 12 week time frame. 50 to 85% of cases develop chronic infection. So over half are going to proceed to that chronic level of infection, unable to fight it off. And this high percentage results from weak immune cells, specifically the CD8 and CD4 T cells. So there's a majority of the population who seem to have a genetic susceptibility to hepatitis C, and they're unable to fight it off, which proceeds to that level of chronic infection. Liver damage and immune response. So hepatitis C is not directly cytopathic. So the damage is not from directly killing cells. The liver damage is due to chronic inflammation. So as we know, the majority of cases are chronic infections, so it's not being resolved. So there's going to be a persistent immune response to the presence of the virus. This leads to fibrosis and scarring. This kind of toughens the liver tissue and reduces liver function, and this can restrict blood flow, this fibrosis and scarring. So when there's restricted blood flow in the liver, more blood is diverted from the body to the liver through the portal vein, because your body's trying to compensate for that restricted blood flow. However, that impaired flow and higher blood volume results in portal hypertension, and that's just high blood pressure in that portal vein. This is kind of a main staple of mid-stage liver disease, kind of showing that progression. This can cause damage to the liver long term. So end-stage liver disease, some of the factors that can accelerate disease progression to this end stage is alcohol use, HIV and hepatitis B co-infection, obesity, insulin resistance, and non-alcoholic fatty liver disease, as well as genotype 3. We mentioned how at the beginning genotypes can affect the severity, so genotype 3 is one that's associated with a little faster disease progression. Some complications that can arise, probably the most well-known one is cirrhosis. This is nodular liver resulting in reduced function. And in 50% of cirrhosis cases, ascites will develop within 10 years. And ascites is this accumulation of a large amount of fluid, typically, in the abdominal cavity. And this is really a sign of end-stage liver disease. The liver is not able to maintain that fluid balance, it's not able to keep up with demands, and this reduced function is really starting to wear on the body. There's a high mortality within 5 years at end stage. So as you can see, the cirrhosis and the ascites, the liver is just not able to keep up anymore. So that explains that high mortality rate. In conclusion, hepatitis C is a serious chronic condition with no vaccine. Early diagnosis and treatment are critical, and prevention strategies and access to care are vital. And these are my references. Thank you.
So I'm covering the hepatitis C case study with Mark, and I'm covering the symptoms and diagnosis. So Mark was diagnosed with hepatitis C 2 years ago, and his symptoms include fatigue, jaundice, mild nausea, and occasional upper right quadrant pains. The common symptoms of hepatitis C include pain in right upper abdomen, abdominal swelling, also known as ascites, clay-colored or pale stools, dark urine, fatigue, fever, itching, jaundice, loss of appetite, and nausea and vomiting. Mark has 4 out of the 11 common signs, and these include fatigue, jaundice, mild nausea, and occasional right upper quadrant pain. The pathophysiology of the human or the hepatitis C virus evades the immune system and replicates unnoticed, attacking the liver. Liver function and jaundice. The liver breaks down bilirubin, and excess bilirubin causes jaundice or yellowing of the eyes and skin. Some complications of the hepatitis C virus include inflammation, and that indicates liver damage. Another is chronic infection can lead to cirrhosis, and cirrhosis is scarred and permanently damaged liver. Diagnosis and lab tests. Hepatitis C virus test, which is exposure. Hepatitis C virus RNA PCR test is active infection. And the last way to test it is AST and ALT levels, which are liver enzymes. Some limitations are false negatives, and it has a very short window period. Some treatments include DAA medications, which are Harvoni, Mavorite, Epclusa, Vosevi. And these treatments are usually 8 to 12 weeks and typically have a higher than 90% chance of cure rate.
My name is Madison Lack. I am part of Group 5, and I will be presenting the nutritional implications of hepatitis C. So, the hepatitis is an inflammation of the liver. The liver processes protein, fat, and carbs. 80% of people that get infected get a long-term infection, which can lead to cirrhosis. There's a link between hepatitis C and muscle wasting as well. So, when hepatitis C disrupts the body, it causes the liver to not make bile, leading to fats not breaking down, leaving essential nutrients and other fat-soluble vitamins in the intestine and causing malabsorption and deficiencies in vitamins D, vitamin A, zinc, and iron. These deficiencies are able to cause several different problems. Vitamin A, for example, can cause blindness, whereas a deficiency in zinc is able to cause brittle hair and impaired immune function. And metabolic dysfunction can also cause insulin resistance due to being less responsive. Nutritional strategies for hepatitis C. So it's best to try to reduce liver inflammation through the use of an antioxidant-rich diet, which would just be vitamin C and E, selenium, and polyphenols, controlling metabolic factors and preventing complications like cirrhosis and insulin resistance. There isn't a standard diet. However, other diets may be beneficial, such as ketogenic, Mediterranean, and gluten-free, which I will get into soon. The best course of action for a hepatitis patient and someone with liver problems of this nature would be low iron, low fat and cholesterol, and high antioxidants. Low iron is good because it reduces hepatic injury, which just means trauma sustained to the liver, and the antioxidants are good these supplements minimize the deleterious effects of the virus and also of the pharmacological treatment. Protein management, avoiding alcohol, and avoiding hepatotoxins are necessary to not further worsen this virus. And the hepatotoxins just means, it's damaging or destructive to liver cells. So soluble type fiber-rich diets are counterproductive. This is because they might contribute to a lipid-depleting extrahepatic, or that also means outside of the liver environment. So it just causes lipid depletion outside of the liver. And antioxidants are really important. It's kind of mentioned in point 1, but the reason that they're so important is because they fight free radicals in the body. And free radicals are bad because they can cause harm to the body if the levels are too high. So what is recommended for a liver healthy diet would be anti-inflammatory, high fiber vegetables and legumes, and a lean or plant-based protein, as well as healthy fats. Some diet types that may help would be ketogenic. That's because it is low carb. It's also high fat, but the reason it may help would be due to the effectiveness for non-alcoholic fatty liver disease. I believe that for ketogenic diet, it's better to focus on the low carbs as opposed to the high fat because that is kind of counterproductive. The Mediterranean diet sounds like a really good fit based off of its description because it is rich in fruits and vegetables, whole grains, and also heart-healthy fats. And the foods to avoid that are bad would be like junk food, fried food, things of that nature. Junk food, in case it is a subjective definition to set the line straight, that would be, food that is really high in calories, but really lacking in nutritional value. Things like candy, soft drinks, ice cream. And there is later on, I have a recipe for a baked lemon herb chicken. It's there's a website from or an article from the American Liver Foundation that gives many examples for liver healthy meal plans to help reduce inflammation of the liver and try to it minimizes fats. They try to really have healthy foods there. And the bottom line is just to eat healthy and avoid inflaming the liver further. So management of hepatitis C, of course, there is no vaccine. So direct acting antivirals are used. It's a newer class of drug. It targets the life cycle of the virus itself. It's really good compared to the older drugs used, shorter treatment time, less side effects, high cure rates. They're used for about 8 to 12 weeks to help clear the virus from the body. And while, doing the direct acting antivirals, they're also called DAAs. But lifestyle changes are also very important. There's no point in using any medicine to help if you're not willing to change your lifestyle, which would just be eating healthier, having a balanced diet, avoiding excess alcohol. And it would also be a good idea to get tested for HIV and hepatitis B. And if the patient was diagnosed with cirrhosis, to get regular liver checkups. Cirrhosis just being scar tissue that replaces the healthy liver tissue, preventing normal liver function. This is just a quick chart of good versus bad foods. Of course, good is just low iron, fat, cholesterol, high antioxidants, fruits, vegetables, legumes, and lean and plant-based protein. We have already went over the bad foods, so I'm going to skip over them. This is just a quick recipe for the chicken that I mentioned previously, just of an example of a liver-friendly meal. It uses skinless chicken just because it's less fat, and it's also, you'll notice it is baked instead of fried because, of course, fried food is not healthy for someone with liver problems, or anybody, really. And this is just a quick chart of diagnostic tests. So you'll see right here that it starts off with the antibody test. This just tests your blood, says if you have ever been exposed, even if it's not currently present, it's just if you have ever had it. And if that's positive, then they will do a PCR test saying if the virus is in your blood or not. And if so, the doctor may recommend a pre-treatment assessment just to figure out the best treatment and course of action. And some of these further treatments would be a PCR genotype test, liver function, fibroscan, PCR, viral load, fibrosis marker, things of that nature. They're down here. They're just a little bit blurrier than I would like. But so with this chart, that wraps up my portion of the presentation. Thank you.
Dietary guidelines. A balanced diet includes lean protein, whole grains, high fiber, and limiting processed foods. Lean proteins include turkey, fish, eggs, and tofu. Whole grains include oatmeal, whole rye, whole wheat, brown, and wild rice. High fiber is also really important for natural bowel movements, and you should reduce high sugar, alcohol, and sodium intake. Some supplements and herbal remedies. Zinc is recommended as well as vitamin D and vitamin B12. And milk thistle has been researched a lot and it has been used in many herbal remedies, but has not been proven beneficial to curing or helping with the hepatitis C virus.
Recent research and controversy on hepatitis C treatment. We'll also cover some lifestyle and behavioral changes and the effectiveness of medical intervention regarding hepatitis C treatment in today's medicine. So a low-fat, normal glucidic, low-calorie diet is shown to increase improvement in HCV patients. These can be things like low glycemic index carbohydrates to avoid insulin spikes and risk for the development of diabetes. Obesity promotes liver inflammation and fibrosis, so it's a good idea to avoid any excess weight, and as well as to avoid that excess weight would be to engage in some sort of physical activity between 150 to 300 minutes a week, and this can be anything that doesn't lead to a sedentary lifestyle, as a lack of physical activity can lead to adipose tissue being added in places where it is unhealthy. And then behavioral support would be engaging in nutrition education, taking a class, a cooking class, or an informational class to learn how to cook these meals for yourself and or for anybody else that you're taking care of with hepatitis C. Just to be aware of the nutritional information regarding the foods that you're eating. The effectiveness of modern medical treatment has actually skyrocketed since the 1990s. Today, there are direct-acting antivirals that work to lower liver enzymes and are actually shown to have a 99% effectiveness rate between 8 to 12 weeks, and actually a reversal of fibrosis in 67% of patients, and even a 43% regression in the cirrhosis, or the actual scarring of the liver, not just the inflammation. A low-fat, liver-friendly diet helps to reduce inflammation in the liver as well by not causing too much GI distress and too much bile to be produced, which could also lead to issues with the gallbladder. Long-term outlook is that most people can look to live beyond their 50s, as well as they maintain healthy diet, exercise, and up to date with medical treatment. It is perfectly reasonable nowadays to believe that the liver can maintain its function into any other issues that may come around, but mainly the mortality and lethality of hepatitis C has tremendously dropped since the invention of these direct-acting antiviral medications. Direct-acting antivirals offer a mainly side effect-free, short-term treatment for HCV, and these can include medications like Grizaprovir and Elbazovir are some of the most popular well-known ones, and genetic genotype predisposed issues are actually being researched so that individualized treatment plans can be come up with for patients that have specific genetic markers and genotypes that are unique to themselves. This can also lead to the eradication of planned of HCV by 2030. And the focus now is not just on managing the side effects, but actually regenerating the liver, as the liver is one of the only organs that is capable of regeneration. Lifestyle factors just to make sure of is to avoid alcohol, weight management, and nutrition support to just slow the progression of cirrhosis. And like we said, innovations like transient elastography and biopsy and interferon therapy boost immunity so that these patients don't encounter any other health risks or fatalities that would exacerbate the mortality of HCV. And finally, we can talk about the controversies regarding the treatment of hepatitis C. Since hepatitis C is considered a virus, it is technically incurable, although through the effectiveness of the direct-acting antivirals, it's actually been discredited and found that just like with HIV, that the lowering of these virus particles within the liver can show no signs of any side effects regarding HCV. Ethical dilemmas would be the research regarding HCV due to the transplants of HCV-infected organs into uninfected patients. And this raises issues as far as the spread of the disease. But HCV is also strongly associated with IV drug use, as it is usually brought on by dirty syringes or infected syringes that contain the HCV virus. The cost and access equity is always an issue when in regards to the medical field. The economic feasibility of these HCV vaccines and treatments being produced also raise financial concerns for these companies that are producing them. And then the importance of the equitable access cannot be understated. These sorts of treatments are life-changing and prolong the lifespan of these patients as well as the quality of life of these patients.
Thank you for watching our presentation on our patient with hepatitis C. Make sure to like and subscribe